Ancient surgeons operated on the human brain without any concept of germs. This video will reveal 10 medical procedures from our distant past that should have been impossible. You will gain a profound appreciation for the forgotten genius of our ancestors, and you will question everything you thought you knew about the history of progress. How did a patient survive a hole being drilled into their skull? What kind of knowledge allowed for a functional prosthetic toe 3,000 years ago? The answers lie in a hidden world of innovation that defies our modern assumptions. What does true medical ingenuity look like when you have nothing but your own hands and your own mind? The first evidence of trepanation is a human skull, unearthed from a burial site that tells a silent but undeniable story. The bone shows a clean, circular opening, and around its edges, you can see the smooth, rounded texture of new growth. This is not damage from a weapon or an accident. This is the clear sign of living tissue that has healed. Someone, thousands of years ago, had a section of their skull carefully removed, and they lived for years afterward. This single relic changes the entire narrative of early human history. It proves that long before written language, before metal tools, and before any formal understanding of biology, communities possessed healers with the courage to intervene and the skill to succeed. The procedure itself was a breathtaking feat of manual dexterity and anatomical intuition. Using a sharp piece of flint or obsidian, the practitioner would have scraped or drilled through the cranial bone with painstaking patience. The goal was to penetrate the outer layers without touching the delicate, vital membrane beneath, the dura mater. Piercing that barrier would almost certainly lead to a swift and serious infection. The fact that so many skulls show signs of long-term healing indicates these early surgeons knew exactly how deep they could go. They were mapping the human body through touch and observation, developing a practical knowledge passed down through generations. But why would anyone submit to such an operation? The motivations were likely as complex as the procedure itself. In cases of a severe head injury from a fall or a conflict, a buildup of pressure inside the skull can be fatal. Relieving that pressure by creating an opening could be a life-saving act of desperation that became a refined technique. Other interpretations suggest a more spiritual understanding. Illnesses affecting the mind or behavior might have been seen as caused by trapped spirits or harmful forces. Creating an opening, a literal window in the skull, could have been intended to release those influences, a physical solution for a perceived spiritual ailment. This blend of the practical and the ceremonial reveals a holistic view of health, where body and mind were treated as one. From the high Andes to the plains of Europe, this practice emerged independently across the globe, a shared spark of medical ingenuity in our distant past. It establishes a profound truth that the drive to heal, to understand, and to alleviate suffering is a fundamental part of the human story. And if they could achieve this, what other impossible feats were they capable of? That same drive to restore a person to wholeness appears in a very different, yet equally profound, form along the banks of the Nile. A woman was laid to rest over 3,000 years ago, and with her was a carefully crafted object made of wood and leather, shaped to resemble a human toe. At first glance, it might seem like a simple funerary offering, something to ensure her body was complete for the afterlife, but the true story is told in the wear patterns. The bottom of this wooden toe is smoothed down from use, and its design includes subtle contours and a system of straps that allowed it to be securely fastened to a living foot. This was not a symbol, it was a functional, working prosthetic engineered for walking comfort. The implications are staggering. Here we have clear evidence that ancient Egyptian society possessed not just the technical skill to carve wood, but a deep, empathetic understanding of human biomechanics and patient care. They recognized that losing a part of the body, especially one as critical for balance as a big toe, was a tremendous hardship, and they dedicated their ingenuity to solving it. Egyptologists studying these artifacts note they were often custom-fitted. The artisans, likely working closely with healers or the individuals themselves, would have gone through cycles of adjustment, shaping the socket to avoid pressure points and aligning the prosthetic to restore a natural gait. This was a process of trial and error driven by a clear goal: rehabilitation. It was about restoring mobility, independence, and dignity to a person's daily life. This challenges a very modern assumption that such thoughtful, long-term care is a recent invention. The wooden toe and others like it, including an even more sophisticated version found on a mummy with articulated parts, reveal a culture that valued quality of life. They saw an individual's need and responded with practical compassion and quiet engineering genius. It stands as a powerful reminder that the desire to heal, to support, and to innovate in the service of another person is a timeless thread in the human story. And if they could engineer comfort for the living, what other daily challenges did they solve with similar brilliance? The principles of restoration and practical care found another, even more intricate expression far to the east. In ancient India, a physician named Sushruta compiled a medical text of astonishing detail, one that described how to rebuild a human nose. This was not a theoretical exercise. Individuals who had experienced nasal loss, whether through the hardships of conflict or other means, faced profound social and physical challenges. Sushruta's response was a procedure of remarkable ingenuity. He described taking a flap of living skin from a patient's own cheek or forehead, carefully keeping it attached to maintain its blood supply, then twisting and grafting it into place to form a new nasal structure. The precision required was extraordinary. His texts explain using specific leaves from local plants as templates to measure and shape the graft, ensuring symmetry and a natural appearance. He outlined exact incision patterns, methods for securing the new tissue, and crucially, detailed steps for aftercare to promote healing and prevent infection. This was a complete surgical system, documented with a clarity that feels modern. Sushruta is often called the father of surgery for good reason. His work demonstrates a profound grasp of concepts European medicine would not rediscover for over 1,000 years, like tissue grafting and the importance of using a patient's own living material to ensure acceptance. But beyond the technical brilliance, his writing emphasizes ethics, compassion, and the healer's duty. This was a medical tradition where advanced knowledge was paired with a deep sense of responsibility. The procedure itself reveals a society that sought to reintegrate and heal individuals, to restore not just function but dignity. It shatters the notion that complex reconstructive surgery is a purely modern invention. Instead, it shows a thread of sophisticated innovation running through human history, often in places and times we have overlooked. Sushruta's legacy asks us to expand our view of medical history, to see it as a global tapestry of discovery where foundational ideas emerged in many cultures long before they became standard practice elsewhere. If such detailed surgical knowledge existed and was successfully practiced, what other advanced understandings of the human body were recorded and then lost to time? This sophisticated blending of observation and belief finds its most astonishing physical form not in a surgical tool, but in a corroded bronze artifact recovered from a shipwreck. The Antikythera Mechanism, a complex assembly of precisely interlocking gears housed in a wooden case, stands as a silent witness to an entirely different dimension of ancient medical thought. For physicians in Greece and Rome, the human body was a microcosm of the universe, its internal balance of humors directly influenced by the motions of the planets and stars. Timing was not just a logistical concern, it was a therapeutic principle. A surgery performed under a certain planetary alignment, or a course of medicine begun during a specific lunar phase, was believed to have a far greater chance of success. This device, effectively an ancient analog computer, was the technology that made this precise cosmic scheduling possible. By turning a hand crank, a user could advance a series of dials and pointers to predict the positions of celestial bodies years in advance, even forecasting eclipses. It translated grand astronomical cycles into a practical, handheld guide for harmonizing human activity with the heavens. The mechanical genius it represents is breathtaking. Researchers like Michael Wright, who dedicated years to reconstructing its intricate gear trains, have shown it models the irregular orbit of the moon with a subtlety that rivals clocks made over 1,000 years later. This was not superstition divorced from science. It was a holistic system where advanced mathematics, precise engineering, and spiritual cosmology were woven together into a single understanding of reality. For a doctor consulting this mechanism, planning a procedure for a day when Mars was ascendant or Venus was in a favorable position was an act of applying the best available technology to optimize a patient's outcome. It framed medicine as an act of aligning the individual with the natural order. This context is vital for understanding the perceived success of their work. When a patient recovered after a treatment timed by the stars, it reinforced the entire system's validity, encouraging further refinement of both the astronomical models and the surgical techniques themselves. Their impossible feats were supported by a framework that made the universe feel knowable and orderly, a framework built from bronze gears and celestial conviction. If their medical philosophy sought to connect the body to the cosmos, where else did they look for patterns and cures in the natural world? The precision of celestial mechanics met the brutal reality of human conflict on the bloodied fields of the Roman Empire. Here, the impossible challenge was not predicting an eclipse, but saving a life in the chaotic minutes after a battle. Visualize a military surgeon kneeling beside a wounded soldier, an arrow buried deep in the muscle. Pulling it out directly would tear flesh and likely sever a crucial blood vessel, causing a swift and tragic outcome. The Roman solution was a tool of elegant, pragmatic design, the arrow spoon. This specialized forceps, called a valsella, was crafted to slide down the arrow shaft, its cupped jaws encasing the barbed head before the surgeon carefully withdrew it, minimizing damage and leaving the wound as clean as possible for treatment. This single instrument speaks volumes about their advanced, systematic approach to emergency medicine. Their medical kits, as detailed by authorities like the encyclopedist Cornelius Celsus, were marvels of organization, containing arrays of scalpels, probes, bone levers, and varied forceps that would look strikingly familiar in a modern surgical tray. They understood principles we now consider fundamental, even without knowing why they worked. They rigorously cleaned wounds with vinegar, an acidic environment hostile to unseen threats. They utilized opium to dull pain and promoted rest for recovery. Most critically, they recognized that foreign objects left in the body led to fever and decline, so removal was a primary goal. This was empirical knowledge earned through grim repetition and careful observation, a science built from necessity. This systematized care extended beyond the tool kit to the very infrastructure of the army. The Romans established dedicated field hospitals, valetudinaria, near their forts and camps. These were not makeshift tents but organized facilities with separate wards, running water, and a staff of trained medics. They practiced a form of triage, prioritizing the treatment of those with the best chance of survival, a harsh but logical strategy to conserve fighting strength. What allowed this high level of organization? It was the product of a culture that valued logistics and order above all else. The Roman military machine ran on standardization, from its roads to its supply lines, and battlefield medicine was no different. It was a calculated investment, understanding that a healed soldier could fight again, making medical care a cornerstone of military strategy. Their innovations laid a practical groundwork for emergency care that echoes through the centuries. It was medicine stripped of cosmic alignment, focused instead on the immediate physical problems of trauma, infection, and pain management. In the calm efficiency of the arrow spoon and the organized bustle of the field hospital, we see a different kind of genius, one born from the relentless demands of empire and the unwavering will to preserve life against staggering odds. If their methods could stabilize a soldier on the edge of a frontier, what deeper, more mysterious understandings did other cultures develop in their pursuit of healing? The philosophical thread connecting cosmic order to bodily health finds a different, more intimate expression in the ancient practice of acupuncture. Here, the map was not of the stars, but of the human form itself, charted with a precision that still resonates today. Long before any understanding of nerves or biochemistry, Chinese physicians developed a sophisticated system based on the flow of a vital energy they called Qi. They believed illness and pain arose from blockages or imbalances in this energy as it traveled through invisible pathways or meridians within the body. The healer's tool was astonishingly simple, a collection of fine metal needles, yet their application was a matter of profound knowledge, inserting these needles at very specific points to unblock, redirect, or calm the flow of Qi, thereby restoring balance and alleviating suffering. This was not random probing, it was a targeted intervention guided by centuries of meticulous observation and recorded in foundational texts like the Huangdi Nijing. The accuracy of their anatomical charts is what feels so impossible. How did they pinpoint these locations, these junctions of influence without modern imaging? The answer likely lies in a cumulative, generational process of trial and reflection. Practitioners would have carefully noted which points, when stimulated, reliably eased a headache, soothed digestive distress, or reduced the pain of an injury. Over time, these empirical observations coalesced into a coherent map of the body's internal landscape, one that linked external points to internal organs and systemic functions. This system's reach extended even further into the realm of surgery. Legends of the renowned physician Hua Chuo describe his use of an herbal concoction called mafesan, a wine-based potion that could induce a state of deep unconsciousness. Patients are said to have slept as if intoxicated or deceased, feeling no pain during major procedures, only to awaken afterward with no memory of the event. While the exact formula is lost, these accounts suggest early, daring experiments in general anesthesia, a pharmacological quest to separate consciousness from suffering. Together, acupuncture and these early anesthetics represent a holistic vision of medicine. It was a practice that wove together precise physical technique, a philosophical theory of energy, and botanical experimentation into a single art of healing. The enduring legacy of acupuncture, practiced globally for millennia and now the subject of ongoing scientific study into its effects on pain and inflammation, is a powerful testament to its perceived efficacy. It challenges us to consider a different kind of knowing, one built not on seeing cells under a microscope, but on sensing the subtle rhythms of the living body and developing an intricate, practical wisdom to harmonize them. If they could chart the body's energy and quiet its pain with needles and herbs, what other subtle systems of the human form did ancient cultures perceive and learn to influence? A gleaming smile in pre-Roman Italy was not merely a gift of nature, but could be a masterpiece of early dentistry. The Etruscans, a civilization that flourished centuries before the rise of Rome, left behind evidence of dental work of astonishing sophistication. In burial sites, archaeologists have recovered skulls where lost teeth were replaced with bridges and crowns, meticulously crafted from gold wire. This was not a simple cosmetic fix. The replacements, sometimes sourced from animals or even other individuals, were expertly anchored to the patient's own healthy teeth with delicate gold bands, creating a stable and functional prosthetic. Analysis of the wear patterns on these ancient teeth reveals they were used for eating, for chewing food over many years. This was a solution designed for the practical demands of daily life. The skill required is breathtaking. Working with gold in such fine, pliable forms demands advanced metallurgical knowledge, an understanding of how to shape and solder the metal without damaging it. More importantly, it reveals a detailed, practical grasp of oral anatomy. The artisan, likely working closely with a healer, had to understand how to distribute pressure, how to secure the bridge without damaging the supporting teeth, and how to shape the replacement to fit comfortably within the mouth. This was a collaborative effort between craft and care, aimed squarely at restoring both function and form. The prevalence of such work speaks volumes about Etruscan society. A diet that could lead to tooth loss, perhaps from coarse grains or other factors, created a common need, but the significant investment in gold and a specialist's time suggests this was a service for those of means, linking dental health to social status and personal pride. It shows a culture that placed a high value on oral well-being and personal appearance, viewing a complete smile as integral to a person's dignity and social presence. Their innovations did not vanish. The techniques were so effective that they were adopted and adapted by the Romans, becoming a part of the broader medical knowledge that spread with the empire. This transmission of technology from one culture to another is a quiet but powerful theme in the history of medicine. It reminds us that progress was rarely isolated, but was often a conversation across time and borders, where a good idea, a proven solution to human suffering, was too valuable to be forgotten. The Etruscan goldsmith, carefully winding a filament of precious metal around a patient's tooth, was participating in that ancient, ongoing conversation about how to mend what is broken and preserve the simple, essential joys of a life lived fully. High in the thin air of the Andes, Inca surgeons faced a brutal and common reality: severe head injuries. The evidence is etched into the very bones they sought to mend. While trepanation was an ancient global practice, the Inca version represents its most refined and successful form. These operations were not simple circular openings, but complex geometric cuts, squares, rectangles, and crosses, meticulously carved into the skull to access specific areas of trauma or relieve dangerous pressure. The tools were crafted from what the mountains provided: sharp obsidian blades and durable bronze toomey knives, each stroke a calculated risk in a procedure that could last for hours. What is most staggering, however, is not the complexity of the cuts, but the sheer number of patients who walked away from them. Studies of remains from sites like the sacred city of Cusco reveal that a remarkable percentage of these cranial surgeries show clear, smooth signs of long-term healing. The bone grew back, sealing the opening with a lattice of new growth. This survival rate is something that would challenge field surgeons even a few centuries ago. It points to a system, a complete medical protocol that extended far beyond the moment of incision. How did they manage the pain of such an invasive operation? While direct proof is elusive, the botanical pharmacy of the Andes offers compelling clues. The coca leaf, chewed or brewed, was a known analgesic capable of dulling pain and sustaining energy. More powerful psychoactive plants, understood for their spiritual properties, could also induce trance-like states, separating the mind from the body's suffering. It is a reasonable deduction that healers would have employed every natural advantage to prepare a patient for the ordeal ahead. But the true genius of Inca medicine likely revealed itself in the days and weeks after the surgery. The survival of these patients hinges on one critical factor: preventing infection in a world without germ theory. Here, their deep knowledge of the local ecology became their greatest asset. They almost certainly applied herbal poultices, mixtures of antiseptic and healing plants known to their culture, directly to the open wound. These botanical dressings would fight unseen threats and promote tissue regeneration, a form of care passed down through generations of empirical observation. This was not a single act of bravery, but a sustained communal effort of recovery. The surgeon's skill was matched by the caregiver's knowledge of herbs and the patient's own resilience, all supported by a cultural framework that valued preservation of life. Developed in the relative isolation of their mountain empire, this peak of surgical achievement forces us to reconsider the very nature of innovation. It did not emerge from abstract laboratories, but from the urgent, repeated need to save a warrior, a farmer, or a leader after a fall or a conflict. Each success, each healed skull, refined the technique for the next. Their story is one of breathtaking human adaptability, proving that profound medical knowledge can be forged in the crucible of necessity, and that healing, even against impossible odds, is a universal and enduring art. While Inca surgeons healed one patient at a time, an empire on the other side of the world was engineering health for entire cities. The Persian solution to disease was not found in a healer's kit, but in the quiet, cool darkness beneath the desert floor. This was the Qanat, a masterpiece of ancient civil engineering that functioned as a monumental public health intervention. Imagine a gently sloping tunnel, hand-dug through miles of rock and soil, beginning at a water-bearing layer in a distant mountain. This underground channel, often lined with stone, would guide fresh, clean water by gravity alone, emerging at the surface many miles away to nourish a parched city or irrigate vast farmlands. The brilliance of the design was in its simplicity and its profound separation. By keeping the water source buried and protected from the open air, it remained uncontaminated by waste, by animals, or by the myriad threats that plagued open canals and rivers. This single innovation prevented illness on a scale no surgeon could ever match. Cholera, typhoid, dysentery, these waterborne diseases that have devastated human settlements throughout history were held at bay by this unseen infrastructure. The Qanats demonstrate a leap in understanding, a shift from treating sickness in the individual to preventing it in the population. It was a proactive declaration that health was not just a personal matter, but a collective responsibility, secured through shared labor and foresight. The construction of a single Qanat was a generational project, a testament to communal will. Teams of skilled surveyors called muqanis used nothing more than basic levels and an intuitive grasp of geology to plot the tunnel's precise, gradual descent from the water source to its destination. Vertical access shafts were dug along the route every 100 feet or so, not only for removing excavated material but for providing air and maintenance pathways for centuries to come. This was sustainable engineering in its purest form, a system that could function for 1,000 years with careful upkeep, supporting the growth of mighty cities like Persepolis in landscapes that would otherwise have been inhospitable. When we consider the medical ingenuity of the ancient world, we often focus on the intimate drama of the surgical act, the healer's hand directly upon the body. The Qanats ask us to expand that view. Here, medicine was the cool taste of clean water from a public fountain. It was the abundance of food grown in irrigated fields. It was the absence of fever in a child's brow. This large-scale environmental management represents a different kind of genius, one of logistics, hydrology, and social organization. It poses a compelling question: does the greatest medical advancement sometimes look less like a scalpel and more like a blueprint? The silent, flowing Qanats remind us that some of history's most powerful healers were not physicians, but the anonymous engineers and laborers who moved mountains, drop by drop, to build a foundation of health for civilization itself. Yet for all the grand engineering of aqueducts and Qanats, the ultimate test of a healer's skill remained profoundly intimate, a confrontation with the delicate machinery of human sight. In the final chapter of this ancient medical story, we encounter a procedure of breathtaking nerve, an operation performed on the very window of the soul. Greek and Roman surgeons, guided by the anatomical writings of figures like Galen, developed a method to treat a leading cause of blindness, the cataract. This clouding of the eye's lens turned the world into a permanent, milky haze. Their solution was a technique called couching. The healer would take a fine bronze or iron needle and with precise pressure insert it through the edge of the eye behind the colored iris. Their target was the hardened, clouded lens. With a careful maneuver, they would dislodge it from its natural position and push it down and away, settling it into the lower chamber of the eye, the vitreous humor. This cleared the path for light to enter once more, offering the patient a return of at least some blurred, shadowy vision. To even contemplate such an act requires us to suspend our modern understanding of sterility and precision. This was surgery at its most elemental, performed without magnification, without reliable pain relief beyond perhaps strong wine, and with no way to seal the tiny puncture afterward. The risks were immense. Any introduction of unseen threats could lead to a devastating infection. The displaced lens could trigger a painful increase in pressure within the eye, a condition we now call glaucoma. And yet the procedure was performed, refined, and recorded for centuries. This was not blind experimentation. It was a calculated intervention built upon layers of observation. Healers would have first studied the anatomy of animal eyes, noting the lens's position and consistency. They likely practiced their needlework on fruits or other soft, translucent objects, developing the muscle memory for that critical, controlled push. Each attempt, whether successful or not, would have added to a collective body of tacit knowledge about angles, depth, and the feel of the lens giving way. The courage involved is almost incomprehensible. For the patient, it meant remaining still while a needle approached their eye, trusting the healer's skill with their future sight. For the surgeon, it was the ultimate exercise in steady-handed focus, a moment where a single tremor could mean permanent darkness. Couching represents the outer edge of ancient surgical ambition. It acknowledges a specific physical cause for an ailment and devises a direct physical solution, however imperfect. It shows a refusal to accept blindness as an inevitable fate, instead choosing to engage with the body's most fragile structures in a daring bid for restoration. This procedure, perhaps more than any other, closes our journey by framing ancient medicine not as a collection of superstitions, but as a bold, hands-on dialogue with the human form. It was a practice of relentless questioning, of trial, of heartbreaking failure and miraculous success, all driven by a simple, enduring impulse to mend what was broken and return the light to a world gone dim. The gleaming bronze needle poised before a human eye, the obsidian blade circling a living skull, these were not acts of desperation but of profound understanding. From the trep and skulls of our prehistoric ancestors to the intricate prosthetics of the Egyptians and the systematic surgeries recorded by Sushruta and Galen, these 10 procedures reveal a hidden history of medical brilliance. This journey challenges a simplistic view of the past, one that imagines our ancestors as helpless before illness and injury. Instead, we find a legacy of quiet genius, of minds that observed, experimented, and dared to intervene with remarkable precision. Each example we have explored demonstrates far more than random trial and error. They represent accumulated knowledge passed down and refined across generations. They required technical skill that rivals craftsmanship in any age, from the metallurgy of Etruscan dental work to the hydrological engineering of Persian Qanats. And woven through it all is a thread of profound empathy, a shared drive to alleviate human suffering, to restore function, and to preserve dignity. These ancient practitioners were scientists in their careful observation, engineers in their inventive solutions, and healers in their compassionate intent. They worked within the frameworks of their own cultures, using the materials and beliefs available to them to achieve what from our modern vantage point seems impossible. They mapped the body through touch, timed surgeries by the stars, and built cities upon foundations of clean water, all in pursuit of a single, timeless goal: to mend what was broken. As we reflect on these marvels, we are reminded that the drive to heal and to innovate is not a modern invention, but a fundamental part of the human story. It is a thread connecting the flint scraper to the laser scalpel, a continuous conversation about life, resilience, and care. Our history is far richer, far more ingenious than we often assume. If you found this journey into ancient medical mysteries fascinating, there are many more hidden chapters waiting to be explored. Please subscribe for more deep dives into the overlooked wonders of our past. And we would love to hear your thoughts in the comments below. Which of these impossible procedures astonished you the most?